Hello, I'm Dr. Bob Rutherford, and this is a Society for Vascular Surgery briefing about studies prior to patient referral. If a patient is referred to me as a vascular surgeon for either diagnosis or treatment, additional studies may need to be done to further evaluate the problem and help with a definitive diagnosis or therapeutic recommendations. While the referring physician may defer the entire diagnostic workup to me, he or she may have already obtained some studies which prompted the referral. In that regard, there are two types of studies that, if already done, are particularly important to examine. First, one would want to review any diagnostic studies that might have been done to establish or strongly suspect that the patient does indeed have some form of vascular disease. Any previous imaging studies should be examined personally to assure their adequacy for decision making and avoid unnecessary duplication. These would include, for example, carotid ultrasound studies, MRIs, or CT angiograms. Since all such studies are the patient's property, legally, obtaining them should not pose any problems. Secondly, it would be important for me to know the details of any studies performed in evaluating associated or comorbid conditions, e.g. cardiac or pulmonary disease, particularly those studies that might have a bearing on procedural risk or longevity outlook should therapeutic intervention be entertained. The patient visit will naturally include a pertinent history and physical examination. Many, if not most, extremity vascular conditions can be confirmed or eliminated by these alone. Often they allow the nature and severity of the vascular disease to be reasonably well gauged. Any additional diagnostic studies that may be required can be arranged in logical sequence after seeing the patient and reviewing any studies that have already been done. Fortunately, vascular imaging techniques have advanced to the point where the so-called contrast studies, where contrast or dye-containing fluids are injected via a needle or catheter inserted into a peripheral vessel, are rarely needed for purely diagnostic purposes or therapeutic decision-making. However, if a non-invasive vascular laboratory is close at hand, one that can readily provide confirmation of the clinical diagnosis, or duplex ultrasound images that visualize the pertinent vascular lesions and the flow disturbances they create, advantage should be taken of this. Similar studies done elsewhere deserve to be seen first and the adequacy of their findings verified. Duplication would only be indicated if the outside studies did not provide reasonable enough evidence on which to base firm recommendations.
This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.